Hello, Kent County. I'm joined by another special guest today. But before I introduce her, I want to tell you a quick story. As you know, we put out a call a couple days ago for a blood drive here at the Kent County Health Department. And I was very concerned that we wouldn't have many people show up for it because everyone is scared, and in some cases rightfully so, about going out into the community. My fears, though, were quickly overcome when I started to see a progression of deputies from our Kent County Sheriff's Department coming here to donate their blood. These are amazing heroes who give so much of themselves for the community. And a couple of days ago, they were literally giving their blood for this community. And so the person I want to introduce today is the leader of that organization and someone who models those values so closely and so much in her life. And that is Sheriff Michelle LaJoy Young. Sheriff, thank you for joining me today.
Adam, so glad to be here, and I have to echo your sentiments about our staff. We've seen tremendous teamwork and attention to our duty and mission to protect and serve the community, and I'm always proud of them, but never more than I have been in these last several days.
So tell me, how are they doing?
You know, this is a trying time, and officers, it's difficult to communicate updates to staff who's in the field all the time. So that's probably our biggest challenge right now, is making sure they have the best information at hand to both answer the questions of the community and also their own concerns. Even in the correctional facility, it's difficult. We have over 700 people who work at the Kent County Sheriff's Office. So that's one of our biggest challenges. And then, dealing with community when there is a lot of concern and strife within the community, it elevates people's emotions when we have contact for normal things. So that's a challenge, but it's one that we're up to, and it's one that our officers are prepared for.
How has the COVID-19 pandemic changed services at the Kent County Sheriff's Office? Can people still rely on the Sheriff's Office for the same things, or have things changed?
There's definitely been changes, but first and foremost, I think it's really important that the community understands that we are still working. We are here serving and answering the needs of the community all day, every day, 24 hours a day. Both inside the correctional facility and outside in the community, and also in our dispatch center. There have been some adaptations that we've made to allow for social distancing, and those are pretty broad spread, but succinctly said, for a law enforcement officer, if you have a call for something you would have called for 3 weeks ago, we still want you to call for that. If it's feasible to take that issue over the phone and do the report that we would normally do over the phone. That's our first attempt. We're going to do that. If it's not feasible, though, we will be en route to your home just like we would have 3 weeks ago. Our officers are given additional instructions, such as maybe you step further away, perhaps you take the report at the door, if that's at all possible. Certainly personal protection equipment like a face mask might be indicated if there are symptoms in that household, just like what you would expect, but we are doing our work every day just as we were several weeks ago before this hit. In the jail, we've had a tremendous amount of cooperation from the area judges, and if there is somebody that for security reasons don't need to be incarcerated right now, they are releasing them to community-based programs that has allowed us to have a little bit more space in the jail, which then allows us to have some locations to separate people who do have symptoms and make sure that they're receiving proper medical care inside, and it gives our staff that flexibility we need to make sure that those provisions are in place even within that very at-risk community within our jail population. So some changes, but all services are being provided just as they were prior to this.
Yeah, that's very thoughtful. And a jail, of course, can be a place of mass gathering. I know you've had plans in place for a number of years with how you plan for it and how you respond to infectious disease. And so those plans have really been in place for some time now, haven't they?
They certainly, and they're proactive plans, and so we really have to be aware that this circumstance could happen really well before the community would be alerted to it. And I'll give an example of a flu epidemic within a correctional facility can be very, very dangerous as well. So when we see a cluster of signs and symptoms, we have always practiced segregation and limiting contact with those individuals until they're symptom-free. We have 24/7 medical staff in the correctional facility, so their needs are being provided for, and we're making sure that people who are eventually released into the community, that they're released in a way that's safe. They're not going to be released with symptoms to go someplace in the community that might not have the proper alert.
Yeah, thank you. Let's talk for a moment about enforcement. And the governor's order, as you know, closed a lot of facilities, a lot of businesses in this county. How should people handle situations where they see a place that's open or a mass gathering that shouldn't be happening? What should they do in order to report those situations?
You know, this is obviously a very specific type of executive order, but there could be potentially more of them as time proceeds. And I would say, by and large, if you're concerned about something in your community that doesn't seem right, or it seems like it might need somebody to take a look at it, we always want you to call law enforcement. And even if it's not an emergency, one of our biggest challenges is convincing people that even though this might not be an immediate life or safety issue, it's still something that could impact the safety of a community. We would like to know about it. So I would tell you in that regard, please call your appropriate dispatch center, and they'll have a law enforcement officer go by. Now, if it's nothing to it, if it's not in violation of the executive order, there's no harm done. But if it is, we certainly want to proactively communicate with that shopkeeper or business owner what the executive order is, how to comply with it, and gain compliance to it. If that doesn't work, we certainly have the ability to cite somebody and issue a citation, potentially do something more dramatic if they refuse to close. But we have, in every circumstance that we've reached out and communicated to people, they've been thankful that they've been educated and they've been compliant and they've done exactly what we've needed them to do. So we hope and expect that will continue.
Well, on behalf of all of us in public health, we appreciate the work that you and your team have done, especially in communicating with the other police chiefs and other local units of law enforcement what these rules are and how we can best enforce them. So thank you.
Glad to do it.
Thank you, everyone, and thanks to Sheriff Michelle LaJoie-Young. I'm Dr. Adam London with the Kent County Health Department. Please continue to like and share these Facebook updates, and I'll be back very soon with another update. Thank you.